So I'm going to take you through some of the important information about starting and stopping anticoagulation treatments safely. So first of all, the starting point will usually be that you have received a new diagnosis, and that may be a new diagnosis of thrombosis, such as deep vein thrombosis or pulmonary embolism, or you may have atrial fibrillation, or perhaps a new mechanical heart valve. When you're referred to an anticoagulation service, the first thing that they will do is perform a thorough assessment. And that's in order to help them make the best decision for you about what treatment would best suit you. So they may ask you questions about any significant past medical history. They will want to know what medications and treatments you're currently taking, and that may include any herbal remedies or supplements that you might take. You may need to have some extra blood tests, or sometimes some other tests need to be performed before you can start an anticoagulant. Your provider might ask you questions about your diet and whether or not you drink any alcohol. Professor Arya has already talked about the risk of bleeding associated with some contact hobbies and sports, and some occupations are a little more prone to perhaps having accidents than others. So you will be asked about that as well. The next thing to decide is what treatment is best for you. And this is a decision that will be made with yourself and your healthcare professional. Now, it may be that your healthcare professional lays out several options that might be suitable for you and helps you to make that decision around which drug and dose might work best for you. Or it may well be that there is only actually one treatment option for your particular situation. Now, when you start an anticoagulant, naturally you're going to want to know how long you need to be on it for. There are some indications, such as a mechanical heart valve, which will require you to always remain on an anticoagulant to stop little blood clots forming, which could increase the risk of you having a stroke. However, for a thrombosis, such as deep vein thrombosis or pulmonary embolism, the starting point is always a minimum of 3 months treatment, and then your individual risk factors will be taken into account and a discussion will be had with you about how long your treatment should last. Sometimes we're asked if there are any alternatives, particularly people who are a bit concerned about having to take a drug, sometimes perhaps for the rest of their lives. Now, it is true that there are some natural anticoagulants out there in some of the foods and spices that we may consume, such as garlic and turmeric. However, those are not as potent as the anticoagulation treatments that we would give you. And also, there isn't the research behind them to guide us on if they are effective or not. So we wouldn't recommend that you opt for a natural alternative over an anticoagulant if you have been told that you need an anticoagulant. It might be that further tests are needed once you start your treatment or perhaps before your treatment, and that will be discussed with you in your clinic. When you're started on an anticoagulant, you will be given a lot of verbal information, which should be tailored to your specific situation. However, it's quite a lot of information to take on board at one time, particularly if you have just also received a new diagnosis, such as a new blood clot. So as well as all the verbal information you'll be receiving, you should also receive something in writing, an information leaflet, or perhaps some links to Thrombosis UK website or other websites where you can find out more about your medication and your diagnosis. You should also be given a contact number as well for your anticoagulation care provider, so that if you have any questions, you can contact them after your clinic appointment. The reason that you're on anticoagulation should be made really clear to you, and if you have any doubts over why you need that anticoagulant, do make sure that you ask your healthcare professional to explain that clearly for you. There are risks associated with all treatments, and with anticoagulation, the main risk is the risk of bleeding. It is very small, and for most people, the risk of thrombosis or stroke will far outweigh any risk of bleeding, hence why you will be suggested to start on one of these medications. It's very rare that people develop other side effects to these medications, but it can happen. So if when you start an anticoagulant, you're at all concerned that you may be experiencing a side effect, always contact your healthcare provider to discuss that. It may well be discussed about the lifestyle impact that an anticoagulant may have on you. For example, if you regularly take part in a contact sport or hobby, such as skiing or rugby, one where there's a high risk of injury, you will be advised to avoid that for the time being. If you're going to be on anticoagulation long term, then there are ways that you can mitigate your risk if it is going to be a huge impact on your lifestyle to give up that sporting activity. So that's something that you'd want to discuss with your healthcare provider. Starting an oral anticoagulant doesn't necessarily mean that you would need to have any time off work, but it is a good idea to let your employer know that you are on an anticoagulant. And it may well be that you are going to need some time off for the particular diagnosis that you've received, such as a deep vein thrombosis. You may well have a repeat appointment booked in when you're started on an anticoagulant. You may well be have this appointment by phone call rather than an in-person visit. Or it may well be that your provider practices patient-focused follow-up. So it may well be your decision if you do need to get in contact with your healthcare provider to contact them should you have any questions. Like I suggested, it would be a good idea to let your employer know that you have started an anticoagulant. I would also suggest that close friends and family should also be updated. And of course, any healthcare provider that you come into contact with, whether that be through the National Health Service, private sector, or any alternative therapies, always let them know that you are taking an anticoagulant. And if you need to have any medications bought over the counter from your local chemist, for example, for flu treatment, also let them know that you're on an anticoagulant, because it may well be that they need to tailor the advice for you. You can see on the screen here a picture of a typical patient information leaflet. This is for the direct oral anticoagulant rivaroxaban that we supply at King's College Hospital. And you can also find lots of great resources on the Thrombosis UK website. On the right-hand side of the screen, you can see a little yellow alert card. And it's important that you receive this when you start anticoagulation and make sure that you keep it somewhere prominent that you're usually likely to have it, like your purse or wallet. This gives details about the anticoagulant that you're taking and also some important contact numbers, so that should you be involved in any kind of accident or should you need to inform anybody that you're on an anticoagulant, that card can be very, very helpful. So some people, like I said, would need to continue anticoagulation long term, and that may well be for something such as a mechanical heart valve. However, some people will be able to stop anticoagulation after a defined period of time. So that decision will be made with you, with your healthcare professional, and it will take into consideration all of your individual risk factors for thrombosis, stroke, and/or bleeding. There are certain practicalities that are helpful to know. First of all, when you stop anticoagulation, you just stop it. You don't need to wean it down at all. You just simply stop taking it. Now, obviously, anticoagulants can be quite high-risk medication, so it's important that when you stop treatment, you dispose of your excess medications safely. So you can take them along to your local GP surgery, your anticoagulation clinic, or a pharmacy locally may well be able to help you. For some people, when they stop anticoagulation, it may be advised that further tests are performed, and that may well be to help determine whether or not you have a further risk of thrombosis in the future. Naturally, some people may feel worried and concerned when they stop their anticoagulation, because it may well provide a lot of reassurance, particularly if you have suffered a thrombosis. And therefore, some people can feel a bit anxious when they stop anticoagulation. Now, that's not uncommon, but you can be reassured that your healthcare professional will have made that decision to stop bringing all of the evidence and research into consideration, as well as the guidelines nationally and internationally, along with your own personal beliefs and risk factors. So, Professor Arya, if you've just been diagnosed with a blood clot, when is it safe to travel?
Thanks for that question, Emma. It's a question we are frequently asked. Travel is, I think, overstated sometimes as a risk factor. Yes, it is a minor risk factor for venous thromboembolism, and the risk is usually increased, by the presence of other risk factors. And risk is largely down to immobility and dehydration during long journeys. So if you have had recent venous thrombosis, we would discourage long-haul travel for a few weeks, say a month, within having that episode. But after that, you should be safe to travel. If you are taking anticoagulation, then that will be very effective in further reducing the risk. If you had a previous DVT or pulmonary embolism and are off anticoagulation, then there's the option of taking either low molecular heparin injection or these days, a tablet of the direct oral anticoagulant immediately prior to the flight in each direction. But I think the common sense measures, such as remaining mobile and well hydrated during the journey and avoiding too much alcohol, are perhaps the most important ones.
That's great, thank you. Jig, a question to you now. Is it normal to feel worried about stopping an anticoagulant?
Yeah, thank you for the question, Emma. Yeah, so a lot of patients who suffer with a blood clot, they do, because the anticoagulation is so effective, when the discussion happens in clinic about stopping, there can be some feelings of anxiousness about stopping because it's treated the blood clot and obviously dealt with the symptoms that the patient may have had. So it is quite normal to feel anxious, particularly if everything is resolved and there's been no problems. So when that discussion is happening, it's important to raise that anxiousness with the prescriber, and then they can discuss what the safest way forward is. What we do know is that when a blood clot has been what we term provoked, the chances of it happening again when off anticoagulation is actually quite small compared to if the blood clot happens out of the blue. So it just depends on what the underlying reason might have been, if we know for that blood clot, to determine whether you need to stay on the anticoagulation or not. Sometimes your prescriber will also suggest reducing your dose of anticoagulation. So instead of having a treatment dose, you're put on what we call a mini dose of the anticoagulation, just to try and prevent a blood clot happening in the future. And that may be an option for you in your specific circumstance. But there's no one size fits all. It really depends on your individual circumstance to how best to treat.
That's great. Thanks, Jig. Another question to you, Professor Arya. How do you go about making the decision about when to stop an anticoagulant?
Thanks for that question, Emma. If you have been treated for venous thromboembolism, we would consider it on an individual basis. I think most important is, did the clot come out of the blue or was it provoked? Generally, people who've had a provoked event, for example, after surgery or pregnancy, would have a much smaller risk of recurrence. The other question is, are there persisting risk factors, particularly immobility? And really, is your risk of bleeding increased for any reason, which we might consider if you did need extended anticoagulation. So in summary, usually 3 to 6 months of anticoagulation would suffice for a provoked clot. For unprovoked clots, we would consider it on a case-by-case basis, depending on what sort of clot you had, what the ongoing risk factors are, and other factors, for example, that the recurrence risk in men is twice as high as the risk in women. So it's very much an individual decision taken jointly by the carer and the patient. If you've had a recurrent clot, then most patients would require long-term anticoagulation.
Thank you. So another question that we get asked quite frequently by people on an anticoagulant for atrial fibrillation is when can they stop their anticoagulation? Because often we advise people with atrial fibrillation that they'll be on it long term, and they may say to us, but I know that my atrial fibrillation has gone away now, or I'm not feeling it anymore. I don't think I have it anymore. And it may well be that atrial fibrillation is something that comes and goes for you. And it may be that you can have atrial fibrillation without knowing it. That's fairly common. But because you've had atrial fibrillation once in the past, the assumption is that you may well be at very high risk of having that again in future. So therefore, anybody that has atrial fibrillation will usually be advised to have anticoagulation long term, because if the atrial fibrillation does come back, the risks of forming a blood clot that could cause a stroke are there, whether you have atrial fibrillation permanently or whether it's something that comes and goes for you.
Thanks, Emma. If you don't mind, I have a question for you. So the question is that I read about some people using stockings after DVT. Are stockings an alternative to an anticoagulant?
Thanks, Professor Arya. A good question. First of all, no, they're definitely not an alternative to an anticoagulant. And the studies that have been done that have looked at stockings have looked at whether they can prevent blood clots, particularly in patients who are hospitalized, which is why quite often people associate them with being in hospital or having surgery. Now, there is some quite old evidence that suggests that they may be helpful at reducing blood clots when people are in hospital. But newer evidence is a little less convincing. And the evidence for oral or injectable anticoagulants is actually a lot stronger. Now, in terms of if you already have a blood clot diagnosed, it may well be that you feel that stockings give you quite a lot of support and comfort and may help with your symptoms of swelling, heaviness, aching in the leg, in which case it's absolutely fine to wear the stockings as long as you're making sure that they fit well, they're not causing any pain and not making any lasting skin marks when you remove them. We used to think that stockings may be helpful at preventing long-term damage to the blood vessels and long-term symptoms known as post-thrombotic syndrome, which is something that around a third of people with deep vein thrombosis will end up having to some degree. However, more recent evidence has shown us that these perhaps aren't very effective at preventing post-thrombotic syndrome. So therefore, our line really is that if they help with your symptoms, fantastic. Make sure that you wear them. And as I said, make sure that they fit you properly and they're not causing you any harm. If you need compression stockings, which are tighter than the hospital stockings, make sure that these are removed at night time. So they're only to be worn during the daytime. And make sure that every day they are removed and your skin is thoroughly washed and checked for any signs of any skin damage.
Thank you, Emma.